Tonight,
I was diagnosed with AML leukemia.
My treatment was worth well over $4 million. My family did not pay a cent.
an ABC 27 special presentation.
Every child has the chance to survive and thrive.
4 Diamonds kind of made the worst time of my life the best time of my life.
Conquering Childhood Cancer, sponsored by Penn State Health Children's Hospital.
Good evening, I'm Deborah Pinkerton. September is Childhood Cancer Awareness Month. Tonight, Penn State Health Children's Hospital will shine light on the courage, resilience, and hope of children battling cancer. Statistics show more than 9,500 children under the age of 15 will be diagnosed with cancer this year in the United States. The most common cancers are leukemia, brain and other central nervous system tumors, and lymphoma. The 5-year survival rate for childhood cancer is around 85%, and that's a significant increase from the mid-1970s. Tonight, doctors will answer some important questions like, what are the latest advancements in pediatric cancer care and research? How important is continuing care both medically and emotionally after cancer treatment? And how does 4 Diamonds help families during a childhood cancer journey? And if you have questions at home, Donna Kirker-Morgan is here to tell you how to get them answered. Hi, Donna.
Hello, Deborah. Dr. Daniel McKeone and Dr. Erin Banashefski, pediatric hematologist and oncologist at Penn State Health Children's Hospital, are answering your questions in a live web chat until 8 o'clock tonight. Thanks for joining us. To submit a question to them, go to abc27.com/childhood cancer. And I'll be back later in the show to share some of those questions with you. Now it's to you, Deborah.
Thanks, Donna. Survivorship after childhood cancer can come with unique challenges and needs. The Childhood Cancer Survivorship Clinic at Penn State Health Children's Hospital is funded through 4 Diamonds. Since its creation, it has helped hundreds of cancer survivors. Moments of so much happiness and joy inside the Survivorship Clinic at Penn State Health Children's Hospital. These 2 young ladies have walked different paths but share the same outcome. They are cancer survivors.
I loved the OPI tracks.
The journey began for 26-year-old Monica Henderson when she was a toddler.
When I was 2 years old, I was diagnosed with rhabdomyosarcoma, which is a soft tissue cancer. It was in the myofascial tissue of my temporal region on my cheek.
21-year-old Gabby Ramos was a senior in high school when she was diagnosed.
They had said that I had Hodgkin's lymphoma 3B, so the number stands for where it's located in your body, which was near my heart, and the B stood for bulky, meaning it was a very larger mass. The mass had actually spread to different places throughout my body.
Gabby and Monica each had personalized treatment plans that worked.
Currently, I'm in my 3rd year of remission. It's going really good.
Monica was considered cancer-free at age 7.
But really, that's just the beginning of, the avalanche of what comes after, and the healing and the trauma and everything of rediscovering how you're going to live with what just happened to you and what still is to come.
And that's where this nationally recognized survivorship clinic steps in.
So the survivorship program is essentially a wellness clinic which looks at the late effects of the cancer treatments that we use to cure cancer. There are also some other late effects that we need to look at, such as psychosocial late effects, mental health.
You don't process something that's traumatic or impactful to you in the moment. It comes later when you're ready to face it. And they're starting to do that now. They're starting to say, I didn't give space to these things that I felt in the past because there was no time for it. I had to survive. I just had to get through.
This was probably one of my favorite pictures as well.
Now pediatric cancer survivors can express their feelings in an innovative program offered at the clinic called Photo Voice, sharing personal memories through photographs.
We think of it as offering an artistic space for our childhood cancer survivors to just share the emotional impact of their cancer experience while being able to also share those experiences with people who have had similar lived experiences as they have.
They do a theme each week. We've had themes from time to impact to visibility. And I think so much of what we're seeing is that two truths can exist at the same time. They bring so many wonderful things each time they're with us.
The first photo was the one of my sister and I, and we have our Mickey ears on and we're getting ready for my Make-A-Wish. Because of my cancer journey, my relationship with my sister will only be as special as it ever is because I had cancer. She was always the person that was able to ground me, and she continues to this day to be that person for me. There's nothing like having a twin. She's like my built-in best friend.
So one picture that I really like just to look at, it's actually me just smiling on the couch at home, because that brings me back to the good days. Those were, something through my chemo that I was always told was take advantage of your good days. Just take it one day at a time. And that happened to be one of my good days.
For these ladies, these pictures are worth 1,000 words and much more.
This project gave me the words and the permission and the constant feedback to be reminded that my journey is okay, and it's actually not uncommon.
I'm able to freely speak how I want and to share, everything that I've been through, and I'm meeting people who are just like me. But again, we've all been diagnosed at different ages, and we all have our stories, but we always end up finding our similarities and differences, and it's something that we can share and we can relate to.
I think we started this as a way to get our young adults together, but I think we have been really floored by how impactful it has been from a bonding standpoint, as well as allowing them to heal in a different way.
We've built a bond, we've built a friendship. We know how we can communicate with each other. It's a free and safe space for you to be yourself and share your journey and share your experience.
And as you just heard Monica and Gabby say, it is so important to be open about their journeys. And they do know that their cancer journey will never leave them, but it evolves and continues to change. Joining me right now is Dr. Smita Dandekar, Director of the Childhood Cancer Survivorship Program at Penn State Health Children's Hospital, and Four Diamonds social worker Meredith Noel. Thank you both for being with us. Dr. Dandekar, talk to us about this survivorship clinic. It's being recognized nationally, and it's making such a unique difference and an impactful difference for so many people involved. Share with us.
Thank you for that introduction and for your question. So our survivorship program at Penn State Health Children's Hospital is truly a multidisciplinary program that offers a variety of services. We have a survivorship dedicated nurse coordinator who spends a lot of time with our families, educating them about the treatments that they have received to cure their children of their cancer, as well as educating them about some treatment-related side effects that may come their children's way, and some of them may be lifelong. In addition, we have a nurse practitioner who sees patients with me in clinic, and our job is to monitor our patients for these treatment-related side effects that I was talking about. We have a pediatric neuropsychologist who screens every patient for cognitive deficits and helps them with issues with learning and helps them get an IEP or a 504 plan. We have a cancer genetic counselor who screens everyone for cancer predisposition syndromes, and we have a survivorship dedicated social worker, Meredith, who screens everybody for mental health struggles, financial constraints, and sets them up with amazing programs as well as support groups nationally and helps them thrive beyond childhood cancer. And the award that you mentioned, we were awarded the Survivorship Champions Prize through Children's Cancer Cause. And it's an award that is given annually to a program around the country. It originated in 2020, and we were the recipient of this award last year. And our program was selected based on our model of transitioning care for our childhood cancer survivors to local primary care physicians that we network with, our extensive rural outreach, our use of telemedicine, and more importantly, all the services that we provide to our children for their long-term health care.
Yes, certainly a lot of different things, but it's all, the main thing is to make children thrive.
Absolutely.
Meredith, this Photo Voice project is amazing. How does it really help them tell their stories?
It gives them the power to tell their stories through their lived experiences by them having a camera in their hands. The pictures were so impactful, but more was when we were meeting, the stories and what they would share. A lot of them talked about their relationship with childhood cancer from diagnosis to now being adults in their survivorship. It was the first time a lot of them felt belonging, and it also helped them create a calm about their cancer, things that they haven't been able to explore before with their relationship with their cancer history.
Yeah, I know that's what Gabby and Monica said. This is really the first time that they've been able to share. Dr. Dandekar, how do these photos really help just providers, family members, the community have a better understanding of what these children are going through?
Yeah, so these photos and some of the accompanying narratives offer a platform for our providers, the community, as well as people involved in their care to really understand the lived experiences of our childhood cancer survivors. And I truly believe it offers an artistic space for our survivors to share the emotional impact of their cancer journey.
Meredith, talk to us about other services that are offered to support the survivors.
Yeah, so when they come to our clinic, I meet them where they are at. So we do assessments, we check on their mental health, we offer them services if they need assistance with financial grants for scholarships, for family planning. We offer support groups. We send out monthly newsletters connecting them with services locally and also in the community to help them thrive.
Yeah. Thrive. I love that. Dr. Dandekar, what does it mean to you personally to be involved with this?
So it gives me immense joy and pride to see that the young children, the teens, and the young adults that we take care of can conquer cancer and thrive. In my opinion, treatment does not just end at cure. It is our duty to ensure that our survivors are truly thriving and surviving. And it's my honor to be part of their journey forward.
Yeah. Thank you both for what you do. Thank you for being here this evening.
Thank you for having us.
And if you would like more information about Penn State Health Children's Hospital, or if you would like to schedule an appointment with the pediatric cancer team, scan the QR code on your screen. Now let's check in with Donna Kirker-Morgan. And Donna, what are some of the questions being asked tonight?
Thanks, Deborah. We had a wide range of questions coming into the web chat. Dr. Daniel McKeone and Dr. Erin Banashefski, pediatric hematologist and oncologist at Penn State Health Children's Hospital, have been very busy tonight. We're going to start with Dr. Dan, as the kids like to call you.
That's right.
And our first question is, it's kind of personal. How does it feel to develop such close relationships with families and then see your patients doing well during their and after their treatment?
Right, so we meet families at their lowest point. Often they've gone weeks to months without an answer for why their child is sick, and then they're told it's cancer. And yeah, that's when we can offer hope. We now have a diagnosis, we can start treatment and get them feeling better. And as they're going through their treatment, we see them very frequently, often every week for months to years. So we really get to know families like Penny's very well over the years. My favorite.
Penny Shangalini.
That's right.
I interviewed her. Such a sweetheart.
She's the best. My favorite visits are at the end of treatment when we can pull their reports, we stop their medicines, we watch their hair grow back, and we can watch them return to their normal activities.
And she's back at school. That's exciting.
That's right.
Here's another question from a viewer. How can families stay connected to new research or clinical trials? I think that's probably when you're on the edge, you want to find the newest and greatest things out there for your kids, of course.
Absolutely. I would encourage families to talk to their primary oncology team and maintain an open dialogue about what they're interested in. And they're going to always keep up to date on what clinical trials are available. For patients with relapsed or rare cancers, clinicaltrials.gov is an excellent resource to get some basic information to bring back to their oncologist, who can help them determine whether they're eligible and help them with the logistics of getting that care.
Thank you, Dr. Dan. And if you have any questions for Dr. Dan and Dr. Banashefski, go to abc27.com/childhoodcancer and submit your questions. Stay with us. We'll be right back.
From the moment he was born, he was our golden boy. Ford had what is called high-risk neuroblastoma stage 4. It had spread to other parts of his body.
It started with chemotherapy, radiation, surgery.
And that was successful, but he had 3 relapses in the brain. It quickly ramped up and turned into a nightmare.
We really needed answers, and at that time, Dr. Sholler moved to Penn State Health. Ford was her #1 priority. She wanted to know every little detail. She reassured us that we still have things that we can do.
He continues to thrive and do really well and have positive results.
Penn State Health gives us a sense of freedom. Most importantly, Ford can go about his life, and our family can just take a breath.
You're watching Conquering Childhood Cancer on ABC 27, sponsored by Penn State Health Children's Hospital.
Welcome back. Student leaders from across Pennsylvania and beyond gathered for the annual Mini-THON Leadership Summit. Since it began, students have raised $77 million. Donna was at the summit and has more.
It was an amazing experience to be at that summit. We heard from a Dauphin County teen who shared her story with the students who make it all possible.
I was basically inside the hospital for a really long time.
18-year-old Sammi Hess is a cancer survivor.
And these days were super duper rough.
At the age of 11, Sammi was diagnosed with a blood cancer called AML leukemia. She's in remission now.
I never was really scared. I was never hopeless. And that was because of 4 Diamonds.
4 Diamonds took away any financial worries for her family. And that's why these students are here. They are here for the kids like Sammi.
4 Diamonds kind of made the worst time of my life the best time of my life.
At this year's Mini-THON Leadership Summit in Hershey, hundreds of students gathered to celebrate their hard work and reveal their fundraising totals.
Enter high school, $46,000!
Knowing that it actually goes towards an impact to help people, I think it's really cool.
Central Dauphin High School, $2 million!
I couldn't even imagine having a kid go through that.
Mini-THON is for the kids, by the kids.
Canville High School, $110,000! Yeah! Stroudsburg High School, $102,000!
Mini might be in its name, but it's a huge part of 4 Diamonds.
Mini-THON started 32 years ago. And since that time, we have built from one school that started the Mini-THON program up to more than 225 schools that participated this year. We were super excited to reveal that they raised $6.4 million this past year to help conquer childhood cancer.
The money raised by these elementary, middle, and high school students goes towards pediatric cancer research and to help kids fighting cancer at Penn State Health Children's Hospital.
To make comprehensive services available to those children and their families, and to drive forward innovative research, all in pursuit of a cure.
All to help kids like Sammi, who now plans to attend school for art therapy.
Hopefully I'll come back here and be a new art therapist on the ward, maybe. Helping kids with cancer like me.
And as you may know, the Mini-THON is modeled after the Penn State Dance Marathon, or THON, which has become the largest student-run philanthropy in the world. Back to you, Deborah.
And thank you, Donna. Joining me right now is Suzanne Graney, Executive Director of 4 Diamonds. Thanks for being with us. We saw you there in the piece. Mini-THON really has grown so much, $77 million. It's unbelievable, really. Remind us what this money raised, what does it go towards?
All of the money that these students are raising is helping us to make sure that every child who comes to us who is a 4 Diamonds child has their care without worrying about a bill, and has therapeutic services wrapped around them and their family members to make sure they have every tool available to be as successful as possible in their cancer journey.
Yeah, and I've talked to parents over the years, and that is just so reassuring. And how do donations to Four Diamonds really impact the different programs you offer?
Sure. The donations that come through Mini-THON or THON or directly from the community to Four Diamonds helps us to cover all of those costs, but also are helping us to create new programs like Survivorship Clinic that you heard about tonight, and to invest in research. That is really the key for the future, and that provides hope for us to be able to learn more, create new ways to treat childhood cancer in the ultimate goal of reaching a cure, not just for Four Diamonds kids in Hershey, but for every child around the world.
Yeah, that is such a wonderful goal. What is the reaction from kids and families when they see so many people rallying around them?
It is just incredible to think, when you're fighting cancer as a child, to see your classmates willing to stand up and raise money in solidarity for what you're going through. Children of all ages are experiencing that, and seeing the community come together to help them. It is at times very, very touching, overwhelming for both the children and their families, but it is what is letting them know they're not alone. So every time somebody is making a contribution or participating in one of these fundraisers, it reminds a child and their family they're not alone in this. We're right here with them.
Someone is walking right beside them every step of the way. THON, preview of THON?
Yeah. Well, THON is set for the third weekend in February 2026, and we just recently had our THON Executive Committee on the health campus. They got a tour of the Children's Hospital, they learned all about what's happening in research, and they can take those personal stories back, infuse those into the 16,500 students who volunteer for THON every year, and really make this a personal experience for all of them and keep them motivated and inspired by these young people that continue to inspire all of the work that we do.
They certainly do inspire everyone, I believe. Suzanne, thank you so much for being here. Always great seeing you.
Thank you, Deborah. I appreciate it.
And if you would like more information, or if you would like to make a donation to Four Diamonds, you can scan the QR code right there on your screen. Let's check in with Donna and get some more answers to our web chat questions.
That's right. Back with us is Dr. Erin Banashefski and Dr. Daniel McKeone, pediatric hematologist and oncologist at Penn State Health Children's Hospital. Dr. Banashefski, this one viewer is asking something that's really interesting to me. What is integrative oncology, and how does it help kids better deal with treatment?
So integrative oncology is this really exciting field of cancer care that utilizes treatments such as mind-body therapies, nutrition, lifestyle modifications alongside our conventional chemotherapy treatments. It's always alongside, always integrated, never in place of. But it just allows us to really tap into all of the health wisdom that we have available to be able to provide the most comprehensive care for our patients to not only improve their quality of life, but improve their outcomes too.
That's exciting. What advice do you give families who are just starting their childhood cancer journey? That's another viewer question.
Oh, that's a big question.
Yeah.
I think the most important thing that I want those parents to hear is to allow themselves to feel what they are feeling in that moment. This is a crazy new journey that they are on, and there can be anger, fear, confusion. Maybe they can't even put a word to it, but they need to allow themselves to process through that. And when they're at the point to be able to take a pause, a deep breath, and decide to lean into the process, lean into the team. We wake up every day going in to be experts providing care for kids with cancer, and not just treat the cancer, but care for the child and the family that walks through the door.
Child. And thank you so much, Doctor. We'll be back in a bit with, we actually have them until 8 o'clock answering questions.
Yep.
In the meantime, I'm going back to Deborah.
And thank you, Dawn. And joining me right now is Dr. Giselle Sholler, Division Chief of Pediatric Hematology and Oncology at Penn State Health Children's Hospital. Thanks for being with us.
Thank you.
So childhood cancer treatment is always evolving. It seems like it's always getting better. What new programs are being developed right now at Penn State Health Children's Hospital?
Yes. So at Penn State Health Children's Hospital, our program has grown dramatically over the last couple of years. And with the advances in pediatric cancers, we've formed teams to be able to really provide the best cutting-edge care for each patient population. As you met Dr. Dandekar earlier, she's a national expert in leukemia as well as survivorship, and leading our leukemia team to make sure that every child receives the most up-to-date care for leukemia. We've done the same with solid tumor as well as brain tumors. And as well, we've added a few additional programs like the integrative medicine program that Dr. Banashefski just talked to you about, really allowing our patients to have all the supportive care they need through their cancer journey, as well as a precision medicine program where we're now being able to sequence every child's tumor at diagnosis and at relapses to understand the molecular mechanisms and biology behind their cancer and what are the best treatments for each child.
Yeah, that is amazing. Can you share some of the latest research happening at Penn State College of Medicine that really could change the future of pediatric cancer care?
Sure. Our patients with childhood cancer are treated initially with chemotherapy, and they often respond very well, and we are able to get most children into remission. The challenge is when these patients relapse. So one of the medications that we've been studying to target the patient's cancer stem cells, which are the cells that then cause the relapse a year or so later after their treatment. We studied this initially in neuroblastoma and received FDA approval for the medication in 2023. Now we've been studying that medication in combination with other medications additionally in other cancers. So we now have a trial opening this month that is going to be looking at preventing relapse not only in neuroblastoma but in other solid tumors and brain tumors as well.
Wow. What are some of the most promising breakthroughs that you see on the horizon?
One of the breakthroughs came through Dr. Bahura's laboratory here at Penn State Health. She's been studying a key driver of childhood cancer called CK2 and found an inhibitor that can block that driver of the cancer and kill the cancer cells. We were able to, with her work, open a phase 1 trial this year here at Penn State Health, which is a trial where these are the first children able to receive this medication for many solid tumors. One little girl on our study, I'm so excited to share that she came onto our study having multiple relapses, very little chance of a cure. She was on oxygen and on pain medications. After a couple of cycles with this therapy, she is now off her oxygen, off pain medications, and bringing us so much hope for this therapy.
Wow, so much hope. Thank you so much for being with us this evening. And we also want to send a special thanks to Monica, Gabby, and Sammi for sharing their journeys, and you, our viewers, for sending in your questions. If you would like more information about Penn State Health Children's Hospital, or if you would like to schedule an appointment with the pediatric cancer team, scan the QR code on your screen. And if you would like more information, or if you would like to make a donation to 4 Diamonds, you can scan this QR code. We do want to thank everyone involved in pediatric cancer care, including caregivers and loved ones. You are making a difference. And we want to thank you, our viewers, for watching tonight. We wish you good health.